So the purpose is to detect a threat, a biological threat or chemical threat that's in the environment, then we can actually avoid it, and then we can start to put measures in place to actually counter that issue. The reality is that in medicine, this is kind of a shocking thing, but between 30 to 70% of diseases are undiagnosed. So even when a clinician sees you in a hospital setting, they probably will give you a diagnosis of gastroenteritis. We have no idea what type of gastroenteritis you have. You might have one of 1,000 different pathogens that cause that. So what we're trying to do is develop assays that tell you which pathogen caused that disease. Then the physician can actually give you something specific to treat that disease. Then it also tells us from a community-based situation whether or not there's a community risk that's going on. Are there lots of people showing up with this specific disease, and do we have an outbreak going on? And so that's what we're trying to develop for that side of the clinical side. We're typically developing one of 3 types of diagnostic tools. So they're usually antibody-based, which are based on little detectors that can detect the pathogen, and that can be on something as simple as like a pregnancy test system. That's a little antibody-based test. So it detects a certain hormone that's in the urine, and same thing we're developing for either blood or for urine or other body fluids. Another method is to use PCR, polymerase chain reaction assays, essentially a method in which you can actually amplify the pathogen out of the blood or out of the tissue. And you can then see it visually with a detector probe that's on that, and that can actually be run on a machine that sees that. And then the last method that we're using now is called next generation sequencing. That's when you take a sample and you actually sequence everything that's in the sample, including the host sometimes. But you're trying to dehost it and then look at the pathogens that are present. And that's the new evolution of what we're doing.